So you see
Okay.
the red button, it's on. Turn it off when you're not speaking.
How are you? What are you doing? Oh my god. Good afternoon, everyone. Welcome to the Children, Seniors, and Families Committee meeting. We're going to just introduce ourselves on the dais, and we'll start with John and go around.
John Mills for the County Executive's Office.
Rob Coelho from County Counsel's Office.
Jim Ramoni for Social Services Agency.
Regina Martin filling in for Ignacio Guerrero. I'm the Deputy Director for DCSS.
And Cindy Chavez, member of the Board of Supervisors.
Dave Cortese, Board of Supervisors.
So today's we're going to start with public comment, and then we have a lot of reports today, and they're all very well done. And so we're going to take a little bit of action just to organize ourselves, and then we're going to dive right into the meeting. We're going to do 3 minutes right now for public comment. I'm going to invite up Scott Largent, and as Scott comes forward, what I wanted to let all of you know that each of you that are presenting, we're going to put a 5-minute clock up for presentations, so that mostly just because we have so many presentations, we want to stay on time and make sure everybody has a chance to present, and we will try to be disciplined about our questions. So Scott, welcome.
Hi, good afternoon, everybody. Scott Largent. I've got a lot of stuff in here going on today, a lot of meetings today. I spend per month, I think about $1,300 to see my daughter. It's very expensive. I have no criminal record. I did every program that the county would provide me, and I thought by now it would be a little easier, and it's just not. I'm still waiting for a letter from it's a drug diversion class. It was supposed to be a slap on the wrist, and I just don't know what's going on over at the probation department. I wasn't even on probation. I wasn't on parole. I don't know how many times I need to call, how many meetings I need to talk at, how many times I need to stand out there with a bullhorn just to get a letter, just a letter that's stating that I completed the program. You know, why put somebody through a program if you're not going to give them the certificate that shows you completed it? It's like this other, and I say a lot of this stuff's a failure. I did a deferred entry of judgment program. If you guys ever have the opportunity to request this stuff from the probation department, you could actually see how outdated this stuff is. They've got a brochure in here and pamphlets of stuff, and they're drugs I never even did. There's stuff I didn't even know about that existed from like the early 80s. I think we should just get stuff that's more updated. I go to a supervised visitation place over off of Coleman, and I go there every week to see my daughter. And, you know, you guys understand I have to be on this visitation, but now this is a really, really weird thing. I had several other friends actually go through the court, fill out the application, go through the process of becoming supervised visitation providers. You guys ready for this? They never did a background check. They never checked out their facilities. Okay? They never looked into anything. They just approved these people. So right now, I'm also going through the process. Now, isn't that going to be weird in about a month when I can actually sit down and be a supervised visitation provider for other people's children, yet I can't even be alone with my own child? You guys kind of seeing what's going on here? That's how I like to follow up things with our county. If it doesn't seem right, I'm going to keep chasing in that direction. That's really weird. That should not be the case. And these visitation providers, none of this stuff's accurate. They don't go out and look at the locations. They don't do background checks. They get unqualified people to sit in a room and watch children. And I have all the visitation reports that I have, and it's like they're at a 3rd grade level. We need to have more qualified people that are filling out these reports and doing these visitation classes, because, you know, I spend $1,200 a month. It's ridiculous, so thank you.
Thank you, Scott. So here's what we're going to do. We have 11 items on our agenda. Item 5 is being deferred. And what I want to do is we're going to give each group an opportunity to present. I'm going to ask staff to come forward. We'll do our best to get through all of these agenda items. But I'll have each panel at 5 minutes. I am literally going to stop you and see if there are any questions from us or from the public. So we'll go ahead and begin with the Neighborhood Safety Center. We'll go through all of these with the exception of the rake, which is going to be deferred. On the dental we'll have a brief presentation on that, but I'm going to refer that item with the consent of Supervisor Cortese directly to the Board of Supervisors to be heard when we hear the foster care item that will be coming to the board, I think, in early November. And then anyway, so we can go through the rest of these items. So if we could begin with the Neighborhood Safety Unit, if folks are here to present on that. Welcome. And I'll ask each panel just to introduce themselves, and then we'll go to work.
Sorry, we're getting acclimated to the microphones. Better. Hi, so my name is Celica Rodriguez Deems, and I'm here with Somos Mayfair to talk a little bit about our work with the Neighborhood Services Unit.
So, excuse me, as you get set up, Ms. Pennypacker, item 5 is deferred. Thanks.
Hola, soy Berta Mendoza y yo quería decir que al grupo Somos Mayfair me dieron una clase de cómo ser líder en el grupo. En ellas yo aprendí cómo ayudar en las tantas necesidades que tiene nuestra comunidad. Y yo quiero darle las gracias a ustedes por su atención.
So Berta, she's been working with Somos for quite some time and just wants to thank all of you for giving us an opportunity to talk.
Thank you.
Buenas tardes, mi nombre es Marilu y quisiera compartirle la visión y misión que tenemos en la comunidad. Sorry.
You're doing fine.
Buenas tardes, mi nombre es Rita Virrueta, soy miembro de la Asociación de Valle Palms Unidos.
Hi, good afternoon, Supervisor Chavez, Supervisor Cortese, members of the Children, Families, Seniors Committee. We're happy here to report to you on some leadership activities that we're doing with the Neighborhood Safety Unit. I'm co-presenting also with Andrea Martinez, along with the ladies who've just introduced themselves from the Valley Palms Neighborhood Association, also called the Valley Palms Unidas. I'm going to go ahead and go through a few of the first slides, and then the leadership team will go ahead and take over from there. Yeah? There we go. Okay. I'm going to have Andrea go through the sort of an overview of the leadership work that we've done with the Neighborhood Safety Unit in the East San Jose area, and then I'm going to talk a little bit about our framework.
So the leadership development started in collaboration with the Crime Prevention Unit, and they started to do workshops with the moms at Valley Palms around crime prevention. This sparked the development of the Valley Palms Neighborhood Association. We started to meet in cafecitos with the moms at Valley Palms just to talk about what it was like to raise their families in the Valley Palms apartment complex. And from those conversations became the Valley Palms Neighborhood Association. Later on, with the support of the Neighborhood Safety Unit and our partners, especially Somos Mayfair, the moms at Valley Palms decided to replace their vertical leadership of a neighborhood association into more of a collective model to share leadership and to make sure that their leadership group is more inclusive and representative of the families that live at Valley Palms.
Great. So essentially, the Neighborhood Safety Unit kind of came in the middle of some of the community organizing work that was already happening in this neighborhood. And we'll go through some of those challenges and assets. But essentially, the Neighborhood Safety Unit is just a part of that process. So we, in our work, what we do when we work with communities is we look at both assets and we look at challenges. So that's the framework that we use. It's a public health framework, but again, our office is housed within the probation department, but we very much take a public health lens when we're looking at communities and working with communities. And so here we've listed some of the assets and some of the challenges. I'm not going to go through these in detail, but they're here for you to see.
So this is our model and our overall approach just generally, but this is how we're also working in Valley Palms. We really are investing in building an alternative community, right? And so what does that look like? It really looks, we really focus on making sure that it is really the leadership in community that is deciding on what solutions they have on issues like public safety, public health, education, just resources and services. And we do that through building strong leadership. And so we focus on moving people from a place of isolation to a place of connection, moving people from a place of not just recognizing their individual power, but also recognizing their collective power and what can really be done when you work in community, when you stop being afraid of each other, when you start to look at the common values that families have. And then really taking collective action together. And so a lot of what we want to share with you all today is really what's been able to happen with the consistent leadership, consistent strategy development, and the consistent participation of about, I'd say 20 to 25 leaders, and really all of that to uplift community power. We strongly believe that it shouldn't necessarily matter that Somos is here right now. Again, our mission is to really ensure that leadership is sustainable beyond any one organization, any one funding stream, or any one partner. So, yeah. Marilu is actually going to talk a little bit about the vision and mission of Valley Palms.
Buenas tardes otra vez. Quisiera compartirle cuál es la visión y la misión que tenemos en Valley Palms. Una de las cosas que queremos es atraer al vecindario para que puedan aprovechar las oportunidades que se nos está dando, tener más comunicación, saber cómo protegernos de la inseguridad que hay y también
So I'm gonna just let the moms, I'm assuming your moms, if you could finish the presentation, and then we won't need the staff to do wrap up. So if you could please keep going. Yeah.
Okay.
You could translate as well.
And a lot of what she's saying is actually what's written. She's just highlighting that they really want more healthier communication between the neighbors, healthier communication with the property manager. They really want to engage more community in developing stronger solutions for the neighborhood.
Thank you.
En la comunidad estamos más abiertos a aprender sobre los recursos que nos proporcionan, como por ejemplo Somos Mayfair, la asociación, y profundizar soluciones para que nuestros niños puedan tener un buen futuro y nosotros como padres tener una buena educación para seguir reforzando el desarrollo de nuestros niños.
That they really want to have different kinds of opportunities for themselves and for their children, so that they're able to have a different way of living, a different standard of living for themselves and for their children in the future.
Okay. Los logros que hemos tenido en Valley Palms, que en este verano de 2018 se dio a los jóvenes, a 120 jóvenes lunches gratis, y aparte tenemos más participación del vecindario, de los vecinos, a participar en nuestra comunidad, en nuestro centro de recursos que tenemos ahí para familias.
So she just shared, she was talking about the very big and important asset that we have, which is the Family Resource Center, and then also the fact that a lot of these leaders have actually been able to participate in different other collaboratives, like the NSU Tech Team, which they're really proud of, the Welch Park and Hillview Airport planning and visioning meetings. And so they've been able to bring to the table really what they want to see in those spaces, and they're doing everything possible to make sure that their voices are heard.
Thank you.
Yeah. Some of the challenges.
I'm going to ask you to, we don't need those. Do any of the other parents want to, the other organizers want to?
¿Quieren hablar, decir algo más?
Please.
Pues nada más quería hacer como una de las tantas necesidades que tenemos en la comunidad de Valley Palms. Valley Palms es una comunidad de 300 departamentos de renta. Ahí hemos notado tenemos una gran necesidad de niñeras certificadas porque hay un gran número de mujeres que andan batallando por eso. Estamos en un proyecto de clases para daycare, para que haya más niñeras certificadas en Valley Palms. Y esa es una de las grandes necesidades que tenemos en Valley Palms.
So Berta's talking about, there's 300 units, and one of the biggest needs that they have is childcare. And so this is something that we've talked about a lot, because even in being able to engage more families in the work of community change, not having the proper facilities, obviously, to be able to have program services, childcare classes, is something that we deal with every week that we're working together.
Good, thank you. I'm gonna stop you there because we have your slides, and I'm just gonna tell everybody here, all of you who are coordinating your presentations, we made an exception in part because I wanted to hear from the moms, but also because of just for translation and all that, we didn't want to be slow. So Dave, did you have thoughts or comments? And thank you.
Well, the last slide said thank you, and I want to thank all of you. I think we both do, for all the work that you've been doing, and there's really been a tremendous amount of progress, over the last several months. It's great to have parents here. Gracias a todos. The child care issue is of huge importance to us on the Board of Supervisors, and I would say particularly to a majority of the members of the Board of Supervisors, and we've been attempting to figure out how to increase funding for that. It's a large-scale problem, but you've certainly created the possibility that at some point we can come and focus on this neighborhood as a starting point to growing our own program at someday. I would just like to say that I know Supervisor Chavez and I have talked about coming out to do a community meeting, so we're grateful that all of you have come. Of course, we always have our great administrative staff here, but that people have come in from the Lanai neighborhood, made their way down to the county to talk to us, and next step is we'd like to come out and visit you where you are. So we will arrange to do that. Thank you.
Thank you very much. Good job, and keep up the good work. So we're going to move on. That's item 5, and I was just reminded that with the deferral of the rake, that we should also make a motion to accept our consent calendar, which was really the minutes from our last meeting. So if we can get a motion.
So moved.
And a second for both of those items. We'll move on now to item 6. This is a timely dental item, and what I wanted to do is we're going to ask for a presentation. We have some speakers, but I'll just kind of warn everybody that we're going to move this item to be heard at the full board at the same time we hear the work that's been done by the task force for foster youth.
Good afternoon, Francesca Ledre with the Department of Family Children Services. I'm the director.
Jackie Howe, Department of Family and Children Services, Program Manager for Medical and Dental.
Rex Keto, Chief of Dental Services for Valley Medical Center.
Great.
George Barguth, Gardner Family Health Network, Dental Director.
Great, thank you.
So thank you very much. I am going to be turning this presentation over to Jackie Howe. She has done a lot of work in exploring the strategies and collaboration that we can have with various partners in the community with regard to timely dental examinations. So I'm turning it over, and I just wanted to thank our partners for being present and supporting this effort.
So at the June meeting of the CSFC, we were asked to explore the dental capacity in the private sector, to explore partnerships with private dentists to provide more options for children to receive medical exams. to explore things with the Family Health Plan and the Valley Health Plan, and to advise what staff support is needed based on the new strategies. We did a little bit of homework, and based on the census, we found that there are actually more dentists in Santa Clara County than there are per capita in the state of California. So in Santa Clara County, we have 1.14 dentists per 1,000 people, and in the state of California, according to the ADA, there are about 0.78 dentists. Where we fall short in Santa Clara County is dentists who accept Medi-Cal. The federal standard is 1 dentist to 2,000 people in the population. In Santa Clara County, we have approximately 1 dentist to almost 3,200 people in the county. So one of the primary reasons that dental capacity is low is the low reimbursement rate for dentists. Dentists get paid much less when they are being paid through Denti-Cal as a Denti-Cal approved dentist. So we explored the options of whether to pay cash, to work through Medi-Cal dentists, and then we found a third option for, which is our recommendation, is to work with federally qualified health centers to provide dental services to foster youth. The county runs some federally qualified health centers that provide dental services, and there are also FQHCs such as the Gardner Family Network who provide services where the reimbursement rate is higher than a dentist can get if they're being paid directly through Medi-Cal instead of being paid through a FQHC. So the joint recommended strategy was for us to explore additional partnerships and ways to leverage FQHCs throughout Santa Clara County to serve foster youth. The question about whether there is a way to invest in dentistry other than Medi-Cal through managed care plans, we talked with the Valley Health Plan and got some feedback from the Family Health Plan as well. I want to thank Laura Watkins and Christine Tomkala. I know Christine had planned on being here, but I wasn't. There we are. We weren't able to connect prior to the meeting, but essentially in the fee-for-service model that most of foster youth receive Medi-Cal as a fee-for-service model, they are not part of a managed healthcare plan such as VHP or FHP. The data for the few kids that is not available locally. We have started the process to request that data from the state, but I'm told that it's at least a 6-month process to find that information out. In the meantime, we're here to answer any questions you have.
Thank you. Would either of you gentlemen want to weigh in, or you're just here to answer questions? Well, thank you very much for being here. What I would like to do is we have a couple of speakers on this item, and if I could have Dolores come forward and Sonia. If you could just come all the way up to the podium would be great.
Good afternoon, Dolores Alvarado, Community Health Partnership, and my comments are very brief. I wanted to let the committee know, and then forward to the board, of course, there are actually 3 federally qualified health centers that are ready to work with the board and with the department on certainly to explore this option. I mean, they do have capacity. One is Northeast Medical Services. They serve children. Indian Health, and she will speak to that. Sonia's here, and of course Gardner, who's been doing that. So we're ready to work on that. I'm also, if you don't mind, I asked Christine to come up. I'm also on her board, and perhaps she can clarify some of the managed care issues.
Great.
Again, as I believe it was represented in the report, as a managed care plan, we are contracted with the state only to provide medical services to the Medi-Cal population, and Denti-Cal is provided through the state on a fee-for-service basis. So I do think that, as recommended, it is most expedient to probably offer something through the federally qualified health clinics. And again, there are, I believe, 5 through Valley Medical Center and 3 through the community clinics that do offer dental services and are happy to try to further expand their programs even beyond what their current capacity is. So we understand this is a really important topic. We're happy to be at the table if we can be of assistance, but working through us is probably not the most direct and efficient route. So please let us know if there are ways that we can assist.
Great. Thank you.
Thank you for the opportunity to speak. I'm Sonia Tetnowski, CEO of the Indian Health Center of Santa Clara Valley. I appreciate the report of the task force, and I also wanted to reiterate we do provide those services, and we do find that there is continued need. I think growth in our areas is always an option as well, because we do serve this population quite well, and it's our primary population in which we serve. We have the capacity, we have the ability, and we have dentists who are highly qualified and trained, particularly to deal with youth with special needs, which is also a category that I didn't hear anyone mention, but tends to be a challenge when working within the foster care system. We know that those additional challenges need to be overcome as well, and I also would be available for any follow-up and any conversation, and would continue to like to be a partner in this process. So thank you so much.
Thank you. Go ahead. Go ahead. Thank you.
I just have one question, and it's not on the insurance side, really on the money side per se, but it's this issue about difficulty with timely appointments, and at least that came out to us in the packet. I don't know if it's a big issue or a small issue. I was sort of responding to it on my own, kind of from the public policy standpoint of what do we do about that from here. Is that an issue, or am I reading too much into that? I mean, an issue in terms of from your perspective.
I'm sorry, I'm afraid I missed the question. Is it whether or not there's a problem in scheduling appointments, dental appointments, timely dental appointments?
Right, and we just gleaned that from the report itself, in terms of strategies to take care of that. And I guess I don't want to. I want to hear a little bit more about that. I'm not looking for a long explanation, but I guess I'm just wanting to be reassured that you can deal with that, because from our standpoint, I'm almost wanting to say I don't want you to invite us to micromanage that issue. I mean, in this county, given the health and hospital system, the efficiency of most of the CBOs that we deal with, you talked about all these different options for how to properly route this population, and it seems like in almost all those cases there's already in existence systems that would deal with that problem. And am I correct in saying all that?
Yes, there are existing systems that are in place to ensure timely appointments. There are also some barriers that we've recently identified with the help of the FQHCs, including Gardner Family Health Network. And we're working on delineating additional mechanisms so that the exams can happen in a timely manner, especially during the first 30 days after a child is placed into a new caregiver's home.
But is it a scheduling issue at all, or is it just an issue of capacity? I guess that's really what I'm asking.
It's really an issue of authority to consent, and that's what we're working on streamlining.
Okay, all right. Well, I'm going to trust that you'll have that under control. And again, it just seems like, I mean, I understand basic obstacles around consent. We're all trained on HIPAA, for example, and other areas of confidentiality in the county. It just
Dave,
seems like
one of the reasons
doable.
one of the reasons I want to have this come to the full board is that we have been working with SSA to try to wrestle this to the ground, and I think there are two issues or multiple issues that are still outstanding. And so what I would like to be able to do is, given the feedback around the possibility of partnering with the FQHCs, and then they are asking for an additional position, that this come to the board as part of the foster care task force work, because I think it'd be the quickest way to get that all moving. And so and I think one of the issues is certainly timeliness. Some of it's, as described, HIPAA. Some of it is access, because even if they get the consent, then where can they go? And it feels like we've been sending people to the wrong place for a really long time.
I appreciate that, and I certainly support that direction. I was trying to discern if this, is more of an access and confidentiality issue, which is what I'm hearing, or just that the systems for actually scheduling on a timely basis were just not ever put into place. So I think I'm hearing that it's more the former, not the latter, or maybe both.
Yeah, I kind of think it's both based on
It's a variety of issues. Jackie Howe is now the manager overseeing and busting the barriers to all medical and dental issues, and she's doing a fantastic job, and I just wanted to acknowledge her for that, and also thank our partners for showing up today for the support, because without them, this coordinated service and coming everybody together, we just would not be able to do that. So thank you.
It sounds like we're going to talk about it some more, and I know
Thanks,
you
Dave.
haven't commented yet, but I support you
No,
in general.
I just want to move this. If we could just receive the report, but then direct it to come to the full board. And what I may do at that time is just take some of the discussion that happened here and do it in the form of a referral from you and I, Dave.
That's great. Thank you.
Okay. All right. Thanks, everyone. Thank you very much. Thank you for coming. We're going to move on to the item number 7, which is the Juvenile Welfare Office of the Ombudsman report.
Good afternoon. Broen Lawhorn, Office of Mediation at Ombuds Services. Katja de Groot was formerly the Juvenile Dependency Ombudsman and now manages all Ombuds operations from within the office. She'll be presenting today's report.
Francesca Ledred, Director of the Department of Family Children Services, and I'm here to answer any questions, should there be any.
Thank you. Thank you for the opportunity to present today on the Juvenile Welfare Office of the Ombuds report. I'd like to start with a brief snapshot of the JWU visitors. We find that the JWU visitors continue to perceive the office as a safe and neutral place. The majority of our visitors are bio parents at 60%, followed by grandparents at about 10%. I'd like to highlight that there were 437 children associated with associated with the cases. We find that we believe that addressing the concerns raised in our office will provide a better impact and outcome for these children. There were 216 substantive cases. Those cases we're finding are becoming more complex and in many instances present higher conflict. There were 663 visitor issues over this period. The majority of those issues were in the communication and social worker behavior categories. We are pleased to report that in both of those categories, the issues decreased from the prior reporting period, and we are hopeful that the child and family practice model is making an impact. Legal process and court records, while not the largest percentage, did have a significant increase for the prior period, for this period, and that related mostly to some continued late court reports. However, we have a process in place with the department now to address that issue, and we can raise those directly to upper management, and we are seeing a tapering off of that problem. The JWU identified 3 trends from the 663 issues. They are bio-parents perceiving that the social worker reports are not comprehensive and strength-based. I have to reiterate that these are a segment of the bio-parents. Visitors perceiving a lack of follow-through on next steps in agreements made in meetings with their social workers, and visitors not understanding the visitation step-down process. These were all, again, perceptions of their experience. The JWU made corresponding recommendations for those 3 identified trends. Very briefly, they are to consistently encourage the department to consistently review court reports with bio-parents, to develop a process for capturing agreements and next steps, to provide a roadmap of visitation step-down process. The JWU sees the relationship with the department as a collaboration, a collaborative effort to address individual case concerns and to provide an avenue, a way for system improvement to be implemented. We do this by the JWU identifying trends and providing recommendations, and the DFCS reviewing and responding. We believe that the improvements, all of these efforts will result in improvements in the quality of services, and that will lead to increased satisfaction with system experiences, and more importantly, lead to safer and more stable family environments. Thank you.
Thank you. So I have a request, and I'm going to ask Supervisor Cortese if there are any concerns about the way I'd like to proceed. I had an opportunity to read the report and to read the responses, and I found most of the responses to be non-responsive. And what I mean specifically is that where there was a concrete identified issue, there was not a concrete yes, no, we will or won't do this, but a lot of explanation in the third box of the report. So that third box says response timeline, I can't remember, that maybe tasks and timelines. What I would like to do is ask Francesca, your team, to go back, take a look at those boxes, and be clear about what the steps are or aren't, and if there's a concrete reason to not pursue the recommendation, I would like to better understand what that is. And my observation from reading it was that there was a very good, thoughtful set of explanations about the condition, like why the condition existed, but not a, here are some next steps. So if you could take a look at that, and then we can bring it back to a meeting that you think, I wouldn't recommend next month. I recognize these things take time, but I really would like that to be gone through. And then I want to, does that make sense as a next step?
Yes, it does.
Okay. And I want to work really hard to create an environment, particularly as it relates to the work we're doing with foster youth. This is a big, complicated, lots of people, lots of rules system. So I know that JWU, you've gone out of your way to say, look, we're here to make peace, build. And I want to maintain I think the strategic relationship that you have with the department. That being said, we do have to create an environment where we can learn and respond without anybody getting in trouble. So that the reason I appreciated that third column is it gave good background for the condition, but it didn't say, here's why we can't, here's why we won't. And I think that's okay. I think we got to be able to do this with foster care. With the Joint Foster Care Task Force work that's going to be coming before us, there is going to be so much that we're going to be redoing and rethinking and re-understanding. And JWU should be a really important component of that. But part of the way I think you become an even more a partner at this is really being able to identify concretely what you're seeing as a problem, concretely what we think the solutions are, and if we don't think that, and if Francesca says that's not a solution we can support, but here's my alternative, I'm fine with that too. We just got to get there. This was fuzzy and loving, which is good, because we're not trying to back anybody up into a corner, but these are our kids, so we got to get it together. So you let me know when it can come back.
Absolutely, yes.
Great.
We'll work on
Thank
that.
you.
Thank you.
Thank you very much. Is that all right with you, Dave? Okay, great. Thanks, everyone. I appreciated all the information, and it was very thoughtful. Thank you. All right, we're moving on to item 8. And this is consider recommendations relating to adult day services subsidy pilot program feasibility study. Wow, that was not concise. But I know this work is complicated, right? All right. If folks could just introduce themselves and... Gail, you're in charge now. Welcome.
Thank you for allowing us to be here to present our ADS study. I am Gail Osmer. I'm the chairperson of the Santa Clara County Senior Care Commission. I'd like to introduce our commissioners that worked on this study. Commissioner Taylor, Commissioner Dubik, and Commissioner Hudgens. They are part of the committee that worked on this whole study. Dr. Monique Parrish is in the audience, who was our consultant, and I want to thank her so much. So I'm going to turn it over to Commissioner Taylor. Thank you.
Hello, good afternoon. Thank you very much for having us here. We're very excited to be here today because what we're presenting is a culmination of a few years of work at the behest of the Board of Supervisors. In 2016, a little background, our commission came together to do a study on adult daycare in the county and found that it was underfunded, underutilized, but yet a highly cost-effective strategy for people aging in place throughout the county. When we put this together, we brought it before the Board of Supervisors and asked for a continuation of this study to a feasibility stage, and that request was granted. $50,000 was allocated to the study, and we partnered with the Department of Aging and Adult Services to retain the services of Dr. Monique Parrish to help us put together this report. So today we're going to present our findings and recommendations to you, and with the hope that you'll forward a favorable recommendation to the full Board of Supervisors for the subsidy pilot. So the main barriers for people taking advantage of these type of programs, and specifically adult day activity programs, is cost, access, transportation, and awareness. So those things come together to provide a pretty substantial wall to people who need to use these services, as well as the caregivers who receive respite from this service. And so taking a look at all of the available data, we came up with a model that would allow us to hopefully address the situation and look more at what a subsidy would do, study that further, and take a look at it at the end of a 3-year phase to provide more recommendations for moving forward in the future. So the slide here is just kind of indicative of some of the barriers that people are facing. The access, again, need, cost, and affordability. Basically, there's capacity, and the reason why some of our adult day programs are not reaching their capacity is because of these barriers. The capacity issue really places an additional strain on adult day programs because many of us take people in for low cost, lower than what we normally charge, or even for free. And so when that uncompensated care, which also affects the health and hospital system, it also affects us at a smaller level. So our study basically outlines our way of moving forward, and that would be for having a $1.957 million program that would be over a period of 3 years that would subsidize 75 individual participants at the rate of $50 a day for 3 times a week for 50 weeks in a year. That also includes $8 to cover transportation costs. And many of the people, almost the majority of people who access these are using access through VTA, and that's the standard cost of a round trip. The potential for leveraging funding partners was a main feature of this study. In addition to the county, we're also spoke with other partners, including SourceWise, the Institute on Aging, Santa Clara Valley Health Plan, and Anthem Blue Cross. In our report, you'll see numbers associated with contribution amounts. Those are really illustrative. We feel like the Board of Supervisors has a much better point to negotiate those contributions, but all of those funding partners would be at the table. They've all indicated that this is a program that's needed and should move forward. So the way that we would administer this would be through a program administrator. That person would determine the eligibility criteria, make inroads with different social service agencies that could provide other resources to our clients, and to help us to gather the data that is collected and process that and come back with further recommendations at the end of the pilot. So with that said, we're hopeful that this is something that this committee finds favorable and would move forward to the full board for hopefully an approval. Thank you.
Great. I didn't mean to giggle, but when you said negotiate with insurance companies, I was like, who does? I mean, so anyway, I apologize. I didn't mean to distract you. So, Dave, do you have any questions?
I have questions. I guess one of the speakers would be fine.
Okay, so we'll do speakers and then questions. I apologize.
Thank you.
I meant to do that. Gail Amstats, Anthony Guinane, and I'm so sorry, from SourceWise, and Halise Oh, Annalise. Okay, I couldn't tell if that was an H. Okay. You know what? And Colleen and Lorraine and Amy and Sandy. And I just want to apologize. We're going to do 1 minute because we have so many of you, and I want to make sure we can finish the discussion. So please come forward, and whatever, you can come in any order if you heard your name, or if you didn't hear your name and this is a topic you want to speak on.
And Commissioner, there's also a John in the audience.
Okay, John, come forward then. Yes, welcome.
Good afternoon. My name is Tony Guinane, and I'm here to talk about how vital the Saratoga Adult Daycare Center has been for me and for the community. I have two perspectives. I was a fire captain for 20 plus years with San Jose, and I also have an elderly aunt who's 95 now who lived with me for 10 years, and she would get in trouble when we were gone. She'd roam around, and I had to call the police twice to find her, and she almost left the stove on. So there was a lot of things. The adult daycare center took care of her. They take her in, they exercise her brain, and they exercise her body, which is something that these warehouses where old people are put, they don't take care of that. So that's my spiel. I think they're so vital, and anyway.
Thank you very much.
Okay. Thank you for your time.
Thank you for your service. Any order, just feel free to come on up.
Hello, my name's Gail Amstutz. I'm a resident of Saratoga, and I just wanted to let you know how important I feel the Saratoga Adult Care Center is. My dad came to live with me about 4 years ago. He was diagnosed with dementia and Alzheimer's, and I quickly realized I couldn't leave him alone during the day. He wouldn't eat, drink, or remember how to use the television, and so he became my constant companion. And as much as he liked hanging out with me, he missed socializing, and he was always a very social person. So he got enrolled in the Adult Care Center, and basically he loves it. He goes there several times a week, and I know that he's being well taken care of. They're warm, welcoming, wonderful people. He gets lunch, he gets proper hydration, activities, exercise, socialization, and at the end of the day, he's had a great day, and I get a break, which is really important as well. I think it's just such a great asset for our community. Thank you.
And there's a microphone over here that David's going to help you with.
Oh, Live Oak has been a very good
a blessing to me, and I see it in my friends who come to Live Oak, and the care that the staff gives is marvelous, and it is clear and direct, and I'm so thankful to have a place to do something like this. It's been easy to not do things, but very boring. And so these people help us to I love the people here, and to see people who are in the same situation that I am in.
And that's your time.
Very good.
Thank you.
And I'm her daughter. I am her paid IHSS caregiver. They've given her 5 hours, but she needs 24 hours. And so it's been really important for her to have the dignity that they provide at the program, and the support and the love to try things that she thought were gone from her. And there's so many other people there that they thought they lost these abilities, but they can find other ways to enjoy things, and in a safe environment, a supportive environment, and they're not just not trying to do things because they think they can't do it. So it's also close to us, so she doesn't get the bladder infections that she gets with the 2.5-hour VTA ride to Mountain View, 15 miles. And so that is a big health benefit. And just having the social stimulation, she's able to speak with a lot more confidence and enjoy her day better.
Thank you. Thanks for bringing your mom. Welcome.
I am the office manager for Sarah Care of Campbell, an adult
And your name,
daycare
sir?
center.
Your name?
John Lehman.
Thank you, John.
I'm here representing Mai Ngo and her daughter Lala. Mai comes to us speaking 9 words of English, and 6 of those she's learned in the 2 weeks she's been with us. Her daughter meets me every day at Sarah Care, Monday through Saturday, at 6:45 a.m. because she needs to get to work, because it takes every penny that she earns to pay for May to go to our facility. I have given families 129 tours in the 42 weeks of 2018. I got my 112th no thank you this morning, and every one of them was because they didn't have the money.
Amy, could you help John fill out a card, just because I want to make sure we have his information? Welcome.
Hello, my name is Lorraine Sunquist, and I am here on behalf of Live Oak Adult Daycare Center. My husband was diagnosed with dementia 10 years ago and has progressed to the point where he needs to be with others. I will tell you that there are two aspects to Live Oak that I consider extremely important. One, everybody says if you're a caregiver, make sure that you are get well cared. And this Live Oak gives you an opportunity to have time to yourself. Secondly, my husband is in a place that is safe, that is nurturing, that is caring, that is loving, and I feel so comfortable with him there. The staff at Live Oak Adult Care Center are fabulous. They're wonderful, wonderful people. And I'd just like to leave you with a testimony that my husband gives me. He says, I would love to tell you that it is a pleasure to be here with them.
Oh, wow. Beautiful.
And our last speaker.
Yes,
afternoon. My name is Annalisa Del Penal, and I'm here on behalf of SourceWise. I'm the Planner and Public Relations Director, and I can say our organization is very interested in participating, and we look forward to what those details look like in the months to come. But we absolutely support the concept of the Adult Day Services subsidy pilot, and I have worked with many years with different organizations like Live Oak, Alzheimer's Activity Center, to support this endeavor.
Thank you.
Thank you.
Colleen, I'm sorry. You are our last speaker.
Thank you. I have some letters that I'm going to submit because they're long and you can read them, but I do want to read one, and the caregivers have already said it. But the one I'm going to read is as follows. If not for Live Oak Adult Day Services, I would have no one to care for my mother during the day because me and everyone else in my family work. My mother has Alzheimer's and can no longer stay alone. My mother does not qualify for any type of assistance, so with her being able to attend Live Oak with the reasonable pricing that they have there really relieves a tremendous burden off my shoulders. There is no way my mom or my family can afford a home caregiver or fully priced day caregiver. Without Live Oak, I really have no idea what to do. It's a good location and my mother really enjoys her time there. I don't have to worry about my mom getting a healthy meal. She's there and my mom is able to get some socialization.
Thank you, Colleen.
So thank you. I'll submit the other three, and that's on behalf of three other caregivers that wanted to be here and get it.
Dave?
Okay, thank you. Supervisor Chavez, I don't know if you have some thoughts about, how to go forward with this in a thoughtful way. A couple thoughts come up. First of all, let me just say, this item and the next item on the agenda today are extraordinarily important, and I know I've asked over recent years for us to start calibrating our budget investments with this doubling of the population that we're going to see in the 10 years, and of course the underlying issues that we're dealing with, symptoms, I don't want to call it that, but disease and so forth that are just require daily attention like this are important and extraordinary issues. So we do have to deal with it, and by default, there really isn't a choice to do these things or not. Having said that, process-wise, and maybe Mr. Mills can give us some initial thoughts on this. Sure, we can move this to the board. We're sort of off budget cycle right now. These are usually the items that come in any number of ways through the executive or through the board offices, probably around March or April, and start lining up for the fiscal year process. It isn't necessarily the case that that's 100% true all the time, but it is something that I know our colleagues try to abide by. Try to avoid off budget cycle investment decisions. Probably more importantly to me than that is wanting to get a feel for scale on this. So normally when we do a pilot of any kind, it's really testing something out to see if it should just be replicated over and over and over again, with maybe marginal growth, 5% inflation, 5% growth in the program per year, and so forth. This is different because this is a pilot, that you've done a great job of explaining in the background, where we have 200,000 individuals over 65 right now, and that's going to be 400,000 10 years from now, basically the size of our entire child population today in the county. And here we have, what will probably turn out to be, if we funded, a great pilot that deals with a relative handful of folks at any given time. So then it raises a question: if the pilot is successful at this level, what are our pro forma growth expectations, and what should the board be aware of in terms of ongoing costs over time, to grow the program. I don't know, and maybe I didn't dig deep enough, cross-analyze all the information that you gave us, and you gave us a lot of good stuff here. I mean, this is ready to roll from what I could tell, applications, a lot of granular detail, and of course you have the experience in the industry to do that. But what I'm not clear on as I sit here today is what is that, what does that graph look like in terms of how we would attempt to grow this program after the 3-year pilot, or even during the 3-year pilot, for 4, 5, 6, ultimately 10 years down the road. I'm not sure we can keep up with the pace of growth of the aging population from an investment standpoint, given current resources. Although I'll say for probably the 10th time, and I'll probably say it 100 times during the course of the year, Supervisor Chavez and I did try to get a half-cent sales tax addition on the ballot so that we could grow these kinds of services, senior services and youth services, among others. So don't take that as a downer. I just want to say, I think I need to understand, and hear from the executive at some point. We invest in this pilot. It's not overall an excessive investment. This about $2 million just on our end, and the matching efforts by others, great. But where does it go from there, and what should we be expecting? Is this ultimately a $50 million a year program, as we try to grow it, especially since it's intended to be pretty much housed here? So I don't know, John, if you have any initial thoughts on that. And
Yes, I mean, and just speaking from purely a process perspective, Supervisor Cortese, you are correct in that the administration typically prefers to consider budget-related requests in total and comprehensively so that we can have the full picture as the administration and make a recommendation to the board on the full picture, and typically that is done in conjunction either with the mid-year budget review, when we take a whole look at the status of the fiscal year budget sort of halfway through the year, or at the end of the fiscal year as we're preparing the budget for the following fiscal year. That being said, as I was listening to your comments just now and reflecting on what you were saying, it's my opinion that sort of all of the sort of questions and concerns that you posed, I would think are ripe for policy discussion among the Board of Supervisors, and that is the direction that we as the administration would look for from the board in terms of, where and to what extent this priority gets ranked against the others, and to the extent that that conversation could start in advance of the budget process and sort of pose some of these questions that the committee is grappling with for discussion among the full board. I think that would just help set us up for wherever we may go in terms of a budget process item.
Can I just add one more thing, and that is, I don't want to, so I'm kind of reluctant to get into the weeds of how we could house this and grow it and so forth, but we just had a special meeting this week on the possible expansion of things around Valley Medical Center because of hospital acquisitions and so forth. So you wonder in context if there's moving parts that create an even more aggressive growth opportunity if we house this properly in an expanded health and hospital system. That said, I just want to close by saying, again, don't take these comments as any kind of criticism of what you've provided here. This is a tremendous start, and it's, to me, I'll certainly defer to Supervisor Chavez, but it's the kind of detail we don't often see in in a report that's coming in, sort of ready to road test. So thank you for that, and I'm for it. I just want to make sure that we're committing ourselves properly to the task at hand. Thank you.
So I want to just address the process questions. First of all, I do want to say the report is really excellent. And I have to say, they come in all shapes and sizes. So this was really well done. So thank you for that. Here's what I would like to recommend as a next step. I have 3 that I would like to recommend for staff. And John, I think some of this plays into the points that you just raised and Supervisor Cortese raised. One is that as part of the package that was presented to us, there's a lot of detail about what outcomes that we're looking for in terms of the pilot goals and objectives. And I think that among these, that the ones that we need to concern ourselves with is the sustainability of the program. And so here's what I wanted to ask that we do. I'd like to forward this to the staff to either bring to the Board of Supervisors or back to committee, and that would really, I'd leave this up to the staff to make this decision, with a refined budget strategy that looks at whole person care, the Mental Health Services Act resources, and resources other than the general fund, in addition to the general fund, as a first body of work. The second body of work that I would like to request is that we consider whether or not this kind of project in relation to those types of funds can be used for a pay-for-success model of investment. And this is really something, Dave, you've talked a lot about, and I think this actually fits in perfectly. And that so that would be second. Third is that we refine the program outcomes to include sustainability, financial sustainability for growth, and an analysis of cost avoidance as part of the pilot goals. Now, here it does say reduce falls, hospitals, and objectives, emergency room, but what I'm really talking about is the ability to quantify over a period of time the impacts, which may bring me to my last point, which is determining target population for the pilot programming, similar to the way we think about our Housing First program, but because what we may want to do is take a mix of patients that we're seeing in emergency rooms or some other kind of high-use environment that could concretely be reduced with these kinds of supportive services, because then it fits into the insurance strategies and the pay-for-success model.
So if you were to add the word sustainability and integration?
Yes.
Integration.
And integration. Yeah, that makes sense. Is that clear to staff? I'm going to come back to the committee in just a minute, but is that clear to staff, what we're asking for? Okay. Any concerns or? And really, when I say this, I do not have a preference that if you get this body of work done in collaboration with the committee that brought it, then it can come to the full board, or if we feel like it is in need of more discussion and public discourse, it's easier to have it here than at the board. We don't want that, because then you get yanked around, and Lord knows what comes out of that washing machine.
Supervisor, I appreciate these recommendations. I think with the whole person care concept, as well as the Mental Health Services Act, we're bringing in partners who are unfamiliar with this at this time. So it would take a little bit of time to bring those new players on board as well. I think that they'd be very supportive of it. I just think it's going to drag this process out just a little bit longer.
Well, and what we may, and again, what you can think about as it relates to program design as to whether or not that means that you have a rolling set of participants, because some facilities are going to obviously be more geared toward that than others. But to be frank with you, I think we're going to have to figure out, all of our institutions, how to start drawing down this money. No. And the Mental Health Services Act money should be easier, but that's from the cheap seats. I say that. Okay. Any concerns or comments that you all have, or do you understand what we just did?
Yes, I would like to thank you for those comments and the fact that you do understand and you're looking at it from a whole person care perspective. That's exactly what we talked about. But we, as an advisory commission, don't have the ability or the wherewithal to delve into how to quantify the numbers. But the idea, the concept was to work with the Santa Clara Valley Health Plan, with their high users of the emergency room and hospital, but we don't have the connections to go in there and make agreements with them, whereas DOS does.
Yeah.
So the hope is that that would happen, but the truth of the matter is that we all know this is happening. And so if we can follow, and we're hoping that the person that we hire will be someone who will be able to quantify after
Well,
the
we're
2
gonna,
year.
that beyond hope, we gotta do it, right?
Yeah.
Colleen?
Oh, no,
Yeah.
it's not
Yeah,
that-
I know what you're saying.
Yeah, we will do it, but it can't be done with a volunteer.
No,
senior
right.
commission.
And this was exceptional body of work that you led. Are any concerns about what we're doing or questions about the direction we've just given?
I have a question about,
Yeah.
are you saying it's going to drag out further, longer?
Well, that's what Jim is saying. I'm not sure I concur with that, because I actually think that one of the opportunities that we have is what I think, if I could just say really quickly, and Jim, you should jump in if this is not accurate, is that drawing down different buckets of money is a challenge depending on the agency. My thought has been that the point that Supervisor Cortese raised about the role of the county could ameliorate some of that challenge for the nonprofits, which is why I think it's worth having a conversation around program design, which is one of the buckets that I just outlined.
I agree.
Yeah, but I understand exactly the point you're raising. Yes.
Hi, this is Monique Parrish. First, I wanted to just acknowledge this extraordinary group of people I had the privilege of working with, exceptional and so committed. I also just wanted to highlight that both Medicare and Medicare Advantage plans and these partners who have jumped in and really said, we're on board, we want to see how we can work, is really highlighting the future, which is Medicare is now looking at adult day services as an added benefit under their Advantage plans. So getting a toehold, I think your questions and thoughts were exactly on point, is really getting there and getting started, doing it in a thoughtful way, and I appreciate fully the sustainability component.
That's an excellent point about Medicare. I think that's right. But I'm also finding that sometimes we have to drag everybody kicking and screaming. So let's get them screaming.
But if I made one last comment, I have actually applied, fill out the full applications for both Anthem and Santa Clara Valley Health Plan to become a provider, but they're trying to figure out the dollars.
Yep. We're all doing it together. Any other concerns? I just want to make sure everybody understands what we're doing, because you did a lot of hard
Could you
work. Yes,
clarify
sir.
that? So you're referring this to the staff?
I'm referring it to
come
staff.
back to this committee and future
Or
time?
the full board,
Or the full
depending on how baked they feel like they can get this and how much agreement that they have. If it's something that can be brought to the full board that's really crystal clear, that can be an up or down vote, we want to do that. If it's something that's going to require a little more discussion, we'll bring it here so we can clean it up before we take it to our colleagues. Okay? Thank you, everyone.
Thank you very much.
Yeah,
All right.
I'm great.
So we're going to now move to the seniors agenda, which if we're going to move to item 9.
Yes, thank you, Supervisor Chavez. I'm welcoming Diana Miller, our Seniors Agenda Program Manager, to the staff table. Diana is our party of one who actually has been responsible for so much of the success that the Seniors Agenda has enjoyed over these last few years, and I would very much like to have her take the opportunity to spend a few moments highlighting again the significant work and a very significant accomplishment made this year through the Seniors Agenda. So welcome, Diana.
Thank you. I want to thank Supervisors Chavez and Cortez for both coming out into the community when we have events, as well as inviting us to come to your home here to give our annual report. I have a few highlights of in only 4 PowerPoint slides. So here we go. In 2015, the State of the County address, President Cortese announced the county's plan to pursue the designation of the World Health Organization's age-friendly status. The Seniors Agenda goal was to have not only the county, but all 15 cities also join the global network of age-friendly cities by July of 2017. Our goal was officially recognized this July, and so we're really excited about that. This initiative has gained momentum in the number of age-friendly cities around the world, increasing from 200 cities in 36 countries 2 years ago to over 705 cities in 39 countries today. We joined the global network to share best practices and learnings of communities. Santa Clara County is the first county in the U.S. to have all of its cities designated as age-friendly.
That's awesome. Good job.
Yeah, are we get applause here?
And the crowd goes wild.
Okay. Our success has sparked Marin, San Mateo, and Monterey counties to start the process of becoming age-friendly also. I have also had the opportunity to share our age-friendly initiative at Smart City conferences in South Korea and at national conferences closer to home. This designation is not a checklist, but a spirit of intentionality by elected officials and the community to elevate policies and programs through the lens of older adults, using the 8 domains of livability and creating new projects to support increased age-friendliness. An age-friendly city is an inclusive and accessible urban environment that promotes active aging. The Seniors Agenda is the backbone organization for community collaboration to address the needs and gaps in services for older adults. With the shared framework, the age-friendly cities, we are beginning to collaborate on our goals, indicators, and shared measurements to track our progress. This year, we gathered the 15 cities together for age-friendly city collaboratives. Topics included lessons learned about disaster response, recovery, and prevention as it pertains to older adults. We heard speakers of the Sonoma County Social Service Agency Director and Napa County Director of Aging and Adult Services to share what lessons learned so we could be prepared. And I think age-friendly projects can be categorized by those that transform, expand, or create. I'll share examples from each category. In transforming, whilst bullying by children has been addressed for several years, we offered a very popular workshop on senior bullying, because senior centers and senior housing, this is a huge problem with not many resources. In expanding our Dementia Friends community initiative, we currently have close to 800 dementia friends, and cities have begun hosting dementia community workshops. The volunteer driver programs like RIDE, Reaching Our Destination Easily, and Morgan Hills Getting Around Town are in their second year and are gaining riders and volunteer drivers. In creating the Traffic Safety and Community Network of the Public Health Department, published the Older Adult Transportation and Traffic Safety Report with recommendations for policies and programs to ensure the safety of older adults, who have the highest number of pedestrian fatalities in Santa Clara County. Our next steps is our 3-year plan of action. Our assessment leading up to that consisted of a survey with 2,500 responses, 37 focus groups involving 400 older adults and professionals. We shared the key findings and priority setting sessions in 2 community conversations with over 100 agencies contributing, and we are in the process of developing a 3-year plan of action informed by the age-friendly survey, focus groups, and community conversations. In partnership with the SSA Office of Research and Evaluation, we're holding domain-specific workshops in October, November to create our 3-year plan of action using the LOGIC model. For example, one of our action items to be included under the domain of civic engagement is outreach for the 2020 census. Our ambitious goal is to present the plan in January 2019 to the Seniors Agenda Network Summit and to the wider older adult community at a senior symposium. I look forward to seeing what innovative and community-focused plans develop to address the needs and gaps in services for the older adults in Santa Clara County. We appreciate your support and look forward to working together to making this a community for all ages.
Did you want to make any comments?
Just a thank you. Thanks for all of your great accomplishments and focus on this. And I know we come out, as you said, to some really excellent convenings, and some of them are just typical luncheon type convenings, but some of them are a lot more fun than that. So we appreciate all of that, and we know that takes a lot of work.
Thank you.
So thank you.
So, yeah, I think keep it up. And I'm so excited you're going to focus on the census. So, great job.
That's one of the big ones coming up, right? So
Yep.
we'll
Yep,
be doing
yep,
that. Yeah.
Thank you. I don't think we have any other questions. We're going to receive the report and say keep up the good work.
Thank
Keep
you very
rolling.
much.
And thanks for the update. We're going to move to item 10, and this is in-home supportive services.
So thank you, Supervisor Chavez. I'd like to welcome Program Manager Terry Posley to the staff table. Terry is our current Program Manager of the In-Home Supportive Services Program, and again, similar to Diana, is very happy to spend the next few minutes sharing with you the accomplishments achieved by the IHSS program this year, as well as some of the challenges that we've been dealing with for the past several fiscal years regarding staffing, and we look forward to receiving her report. That is not the correct slide deck. This is for the next item. There it is. Yes, thank you.
Thank you. How about now? No? Maybe I should switch mics. Oh, okay, I'll just speak.
Good afternoon, Chair Cindy Chavez, Vice Chair Dave Cortese, and members of the committee. My name is Terry Posley, and I am the IHSS Program Manager. Thank you for allowing me to quickly highlight the changes to IHSS this past fiscal year. The highlights describe ways that IHSS providers can receive their paychecks more timely and efficiently. Next slide, do I have the controller? Here it is. On June 5th of last year, the California Department of Social Services implemented a new electronic timesheet service that allows IHSS providers and recipients to electronically submit and approve timesheets through a new electronic timesheet services website using their tablet, smartphone, laptop, or computer. It's an optional service that is meant to reduce the time for a timesheet to be received and processed by eliminating the reliance on the U.S. Postal Service. Following the pilot of 3 counties, there were 4 waves of implementation, and Santa Clara County rolled out on October 10th of last year, a year ago today. Providers and recipients can now register online. Once the user is registered, he or she can then submit timesheets online. The users are now able to review and approve timesheets, view their timesheet history, and check timesheet and payment status. For providers who are submitting overtime, violation warnings will pop up on their screens to avoid errors and violations for going over claimed overtime hours. And with this online service, there is no postage required, and there's no extra mailing time for paper timesheets. Because of all of these features, electronic timesheets result in faster payment for the IHSS providers. In February of this year, the state sent notices to all of our IHSS providers that online direct deposit services are now available on the IHSS website. It allows providers in all of the California counties the ability to electronically enroll, change, or cancel their direct deposit service through the IHSS website instead of using a paper form. So while direct deposit is not new, the process of enrolling, changing, and canceling online is new. And we try to encourage all of our providers to enroll in direct deposit because paychecks won't get lost or stolen, providers are paid quicker, there's no need to wait for the paycheck in the mail, and direct deposit results in faster processing and faster payment. Senate Bill 3 was signed into law by Governor Brown on April 4th, 2016, and the bill allows providers to accrue 8 hours of paid sick leave each year of employment beginning July 1st of this year. And upon implementation of paid sick leave, existing providers will earn 8 hours of paid sick leave after they have worked 100 hours from the implementation date. And paid sick leave can be used for things such as medical, dental, chiropractor appointments, illness, counseling service, or any other medical emergencies. Providers can also submit sick leave claims electronically through the IHSS website instead of using a paper form. And paid sick leave is issued on a separate paycheck other than the regularly issued IHSS paycheck. And at the beginning of each fiscal year, providers will have a new balance of sick leave to claim, which is determined by the state. At IHSS, we have always striving to improve our services to the community, and these few changes that have occurred in the past fiscal year have already decreased the wait time for the providers to be paid. And we are hoping to get the word out to IHSS recipients and providers that enrolling in electronic timesheets and direct deposit will enhance payroll processing time. And at this time, we'd be happy to answer any questions that you have about IHSS or the annual report.
Thank you very much. And Supervisor Chavez, to get to another important engagement, she just did share with me a point that is probably worth discussing in the aftermath of this meeting, and I know she just said she would give some more input on that, but that is just to try on our end to increase the access to banking that people will be inclined to use. In the past, around payday lending and some other issues that we kind of jumped into from a social justice standpoint, we were able to bring some of the more social justice and equity-minded credit unions in the Valley together just to brainstorm about how to make access easy and efficient for people on that side of it. So just looking at this is great. It's a great tool. Hopefully it continues to function or it'll function efficiently down the road, but it is probably up to us in the counties to try to help facilitate the actual usage of it, especially for people who either have some sort of traditional fear of banking or just don't want to pay fees or whatever the cost may be. There's so many reasons that people see as, so many barriers that people see, unfortunately, still. And I know Supervisor Chavez indicated she's willing to help facilitate some of that kind of dialogue. I don't have any other questions. It's a very thorough presentation, and other than I think we all wish we had more money to put into the payroll so that before it goes into the accounts.
We do too.
Yes, I know that, and we're all keeping that in mind. But that aside, we'll just go ahead and informally receive the report as a committee of the whole. Thank you.
Thank you very much.
Thank you. Next up, if I can also introduce this item, Supervisor Cortese, the In-Home Supportive Services Public Authority has been a long-standing management services agreement that the county has held with SourceWise, and I'd like to welcome Mary Tinker, the Director of the Public Authority, who will present the annual report of the Public Authority Advisory Board. Thank you, Mary.
Thank you. It's nice to be here today. Thank you for taking a look at our report. I do have hard copies that I've brought to make available as well on the back table. Let me use this. Okay, Public Authority Services, we've been actually partnering with the county since 1999. It's been a wonderful partnership between SourceWise and the county. As you know, the Public Authority provides a registry of pre-screened providers. We screen those providers. We provide training for IHSS consumers and providers. We administer the health, dental, vision, and transportation benefits for the IHSS providers, enrollment for every IHSS provider, and Department of Justice background check. We act as the employer of record for the collective bargaining, and we staff, well, actually I provide staffing support for the advisory committee, the IHSS advisory committee. This last year, the registry provided a record number of lists for IHSS consumers. That's part of what we do to try to act as a comprehensive search to help the consumers that don't have a family or friend to provide their services to try and help match them with those folks. Part of what takes a tremendous amount of time are the interventions, basically doing problem solving. So if you can imagine Match.com, It's not romantic at all, but it's definitely important for us to try and help the consumers find the right worker to provide their care. As the employer, the consumer hires who they choose, but as problems arise in any relationship, we try to intervene when they ask us to try to help maintain those relationships for as long as possible. Part of what we set up a few years ago based on request from the county was a care coaching component of the registry, and this is where we have more hand-holding. We have the care coaches who actually assist them with interviewing providers, help them to work out problems that they may be having with them. We provided 440 referrals, or we received 440 referrals for the care coaching. These are the people who don't have anybody to really help, and they really need that extra assistance because they're not capable of interviewing on their own for a lot of different reasons. Our urgent care registry is a safety net, and we provided 306 hours this last year, which was a 49% increase over the previous fiscal year. This is something we've been providing since the early 2000s, and I have to say that we've seen the largest uptick in the requests for the urgent care than we ever have before, and this year it seems to be moving in that same direction. Provider enrollment, it's a very efficient process. We actually are able to process between 400 and 500 brand new providers in IHSS every month, and that's having to see every single person and run them through the whole process. We also, on our benefits administration, working with Valley Health Plan, and if you take a look at the report, you'll see where has actually been the downshift, so that in the two plans that were set up, the classic plan and the preferred plan, we actually have had the shift so that we're getting where we want, where the board wanted us to be as far as reducing the number of people on the classic plan and the increase on the number of people on the preferred plan. Benefits administration, we're continuing to see a lot of growth in that, and as you know, there are no caps on the number of IHSS providers that can enroll in the benefits, so it's a continual uptick. Finally, what I'd like to leave you with is the recommendations from the IHSS Advisory Board. They are very concerned about not having sufficient staff at the IHSS administrative offices, where Terry Posley was just talking about. They haven't had an increase in 10 years in the number of clerical staff. That impacts the consumers because it takes longer for them to get the help that they need. It slows everything down, and so that is one of the top priorities for the advisory board. The MOU with the managed care plans would like to expedite an MOU with the managed care plans for the IHSS assessment services. That saves time and money getting people discharged from hospitals. Thank you.
Okay, thank you. I guess this is just the overall question that I should probably already know the answer to, but you know, in terms of the overall funding dilemma with this sort of hybrid, you know, fiscal situation we have between us and the state on IHSS, but some of these numbers, you know, are staggering, I guess, is the word of the month in terms of some of my commentary on numbers that you just don't ordinarily see, you know, around county service delivery. And again, I totally get it that it's not our fault, so to speak, at the county level, but you know, 101% increase in providers over the past 11 years, I think, is a number that I gleaned from the report. That, you know, against really virtually no new funding for trying to handle the calls that are made to IHSS on any given month. So I don't want, I'm not trying to put anybody on the spot, but is this just one of those situations where ultimately we're going to have to live with the gap and try to keep up given the trends now? I'm asking of either of you.
Mary, I'll go ahead. One of the issues that we've been addressing in this current fiscal year, Supervisor Cortese, is several different methods of efficiency through our continuous quality improvement program within our own agency. So we're looking at better ways to handle and process the existing work that we have. We're midway through that process right now. We do anticipate that we'll have better data by the end of this calendar year. We're also beginning our budget conversations within the agency this month because our CFO is hoping to have all of our budget requests completed before the end of December so that we can start looking at that. So we do have actually a scheduled meeting with the IHSS program management team this next week, and to really strategize along the lines, because the IHSS program has been so underfunded these last few years, and I certainly can concur with the concerns that the advisory board has. Terry and I have these same issues, and we have had for the last several years. One of the things that I do want to highlight is that through an effort, through a unit-based team that Terry and her team were engaged in last year, is that we have seen a significant reduction in our call wait time for individuals that are calling into the IHSS main number. We've also implemented a voicemail option so that people don't have to stand and sit and wait on that phone line for, at one time it was up to 90 minutes where they might have to wait for a live caller. They now have a voicemail option, and that voice, if they choose to leave that voicemail, they can leave that voicemail within the first 2 minutes of their phone call, and they do get a phone call back within 24 hours of leaving a voicemail, and that's been consistent, and I'm very proud of that accomplishment. I don't want to minimize the issues, though, that you're raising and that the advisory board has raised, and I think that these are issues that we're going to continue to strategize and work on so that we can present a thoughtful budget proposal this coming fiscal year as well.
Right, and just to voice an opinion, I guess, I'm certainly not opposed with increasing clerical staffing to start trying to mitigate that problem. And I suppose to some degree that's going to have to happen, whether, we feel like it should be a burden on us or an unfunded mandate from the state or whatever it is, we're going to have to deal with that. And I'm also not a proactive proponent of automation, although what we saw earlier on the earlier report with the electronic time cards, I mean, it's got to be taking some burden off of somebody if it works, if people opt in and are trained and understand how to use it. Automation on this side of things, probably needs to be part of the brainstorming. I understand what you're saying about just basic technology like being able to leave a voicemail message, but maybe beyond that. I always think of those kinds of solutions when they work as good one-time investments, capital investments, instead of ongoing costs from a budgetary standpoint. And we're in this for the long haul. The population, as we've heard all day long here, is going to keep growing, which means service providers are going to keep growing. We don't know what the state's going to do in terms of funding. I know the board has, and the county executive has significant concerns about trying to chase, the problem with general fund investments, because it's almost bigger than our general fund can handle at optimal service delivery. So I just think automation, technological solutions are going to have to come into play at some point, barring a watershed moment from the state of California, and we're not expecting that anytime soon. So that's my 2 cents for whatever it's worth. And if the board, the committee or the board can help pilot, those kinds of one-time investments to see if they work, please let us know.
Okay.
That's all I have. Thank you. And again, we'll receive the report as a committee of the whole. And we'll move on to item 12. apologize if I've been speaking too far from this microphone all afternoon.
No. So thank you, Supervisor Cortese. Bob Minicucci, our agency director, and I had an opportunity to speak before today's meeting, and the one issue that he did want me to bring to the committee's attention is that of proposed changes to the public charge determination, which is a significant issue that's been brought to the attention. It's a proposed federal change, and I actually learned today that the proposed public charge rule has been actually posted to the federal website, which now engages a 60-day comment period for individuals to make comment about the proposed changes. What is public charge? Public charge, according to the National Immigration Law Center, public charge is a term that describes persons who cannot support themselves and who depend on benefits that provide cash, such as temporary assistance for needy families or SSI for their income. Depending on immigration status, the Department of Homeland Security or U.S. State Department consular offices abroad can refuse to let individuals enter the United States, re-enter the United States, or become a lawful permanent resident if they think they will not be able to support themselves without these benefits in the future. What is significant about this proposed change to the public charge determination is that the federal government is now proposing that in addition to cash aid programs that this has historically been limited to, they're also now proposing to include programs such as Medicaid or Medi-Cal, of course, here in California, the Supplemental Nutrition Assistance Program, or CalFresh here in California, as well as the potential for housing vouchers through Section 8 also be considered part of the public charge determination. That is distressing on a number of levels because all of a sudden it's not just going to be focusing on cash assistance. It's also going to be focusing on potential just tangible services that our low-income clients throughout the state rely on. So we have to keep an eye on this particular issue, and again, this was just posted today to the Federal Register, meaning that there's now a formal 60-day period where public comment can be garnered, and then after that 60-day period on December 10th, the federal government will then take all that commentary into consideration before they issue a final ruling. So again, significant proposed changes to the public charge, and something that we're all going to be monitoring for the next few months.
Okay, thank you, Jim. And do we have a report from Department of Child Support Services?
Yes, it's a very small report. I'm actually appearing on behalf of Ignacio Guerrero, who is attending a board meeting today in Sacramento.
Thank you for doing that.
So I of course, am going to just share just a little bit about what's happening in the department. We have experienced quite a bit of growth over the last 8 months, and due to several promotions and retirements in the office, we've hired recently 1 child support supervisor, 1 information systems analyst, 2 senior child support officers, 24 child support officers. That includes 6 of those would be child support officer 2s, and 18 are child support officer 1s, 6 legal clerks, and 2 OS3s. So with that said, our training department has been extremely busy and doing an excellent job getting these folks up to speed and ready to take on the assignments that we have for them. So we've just been very busy, and so I just wanted to report out and let you know what's been happening recently in the department.
Okay, thank you for that. And we'll just let the record show both reports have been received from the 2 directors, and that brings us to item 15, which is adjournment to our next regularly scheduled meeting, which would be Wednesday, November 14th, 2018 at 2 p.m. right here in these chambers, and of course that would be publicly noticed. Let me pause for a moment, which is unusual to do after announcing an adjournment, and acknowledge that we received some written comments from Blue Ka. Is she actually here in the chambers? I didn't see her. She stepped out, but she did submit her comments. Oh, there she is.
Oh, she is still here.
My vision isn't as good as it used to be. Did you want to speak to this, or just submit your written comments on the record? If you want to speak, you need to come up, and I just want to allow you that time, even though we're in the process of adjourning the meeting. I wasn't trying to cut you out of the conversation here. Just for the record, she had asked to speak or submit written comments on item 11, and I made up my mind they were written comments before I asked you, so go ahead.
Yeah, thank you. My name is Lokali. I'm a new commissioner for the CARE, and also wonder about that the program for the in-house service. I heard community and neighborhoods sometimes they complain about that. The in-house service program request them to join with the union, but sometimes they're low income, they don't want to join union. So that minus the salary for them. So they asked that it might cannot join or not. So I just, because the item over, so that's why I thought it's over.
I understand.
So I just asked the manager, and she said that not obligated. But I heard too many complain about that, because when the caregiver came to register for training, and the staff always say you have to sign for the joint union. If you don't sign joint union, so in future you file, you cannot get another job. So they feedback to me like that. So.
Yeah, I'm sure it's all a little confusing. I will tell you, let me have my staff help you, retrieve some of that information for you so that you can share it with others in the community. That's nice of you to do that, people who are asking those kind of questions. And to the extent we need more information, we'll get it from the Employee Services Agencies. They can give you very accurate information on that. But I will tell you that no one would be retaliated against by the county, whether they were a union member or not. All employees are treated fairly. But thank you for bringing those concerns to our attention, and I will make sure that my Chief of Staff, Mike Donahoe, or Enrique Flores, who is here today, we know how to get a hold of you. We've been in touch with our office, so we'll make sure to get you that information.
Right, thank you.
Okay, thank you.
And another case too, I heard some community told that they do in-house service to get salary, but they get another job, so they left for some another person to take care and pay for them.
All right, well, any complaints that you hear or concerns or whistleblower items from the community, my staff can help direct those to the appropriate authorities here at the county.
All right,
Thank you for bringing it to our attention.
Yeah, thank you very much.
All right, appreciate all of you being here today.
Yeah, thank you for your attention. All right, I will email directly to supervisor about own case and feedback that. All right.
Thank you.
Thank you.
Thank you very much. And we'll just show her comments. We received the report under item 11. There was no action to reconsider, so we'll just show for the record that she did decide to speak on item 11. And we are officially adjourned now. There's no other business. Thank you.